Welcome to Menopause Basics with me, Bev Thorogood. In this short video, I'm going to be explaining what menopause is and the different phases of the menopause transition. Menopause is the point at which women, or those born with female sex organs, stop menstruating. Usually this is a natural process that happens somewhere between the ages of 45 and 55, but it can occur earlier, either with or without medical or surgical intervention. It's commonly accepted that a person has reached menopause when they've been period-free for 12 consecutive months. In essence, menopause is just one day. It's the day to 12 months from the last period. However, the process leading up to menopause, known as perimenopause, can start when the ovaries begin to produce less of the key sex hormones, particularly estrogen and progesterone, as the natural egg supply stored within the ovaries runs out. The phase between puberty, when our periods start, and menopause, when they stop, is known as pre-menopause. And the period following menopause is known as post-menopause, and this phase continues for as long as that person lives. Perimenopause can start anywhere from around 2 to 3 years before menopause is reached, up to as much as 10 or even 12 years. Everyone is different and there are no absolutes. About 95% of women will have reached menopause between the ages of 45 and 55. However, there are many women who experience early or premature menopause under the age of 45. Menopause is considered to be early if it's reached between 40 and 45 years old, and premature if under 40. And around 1% of women under the age of 40 will be diagnosed with premature ovarian insufficiency, or POI. Now, this condition causes the ovaries to produce an insufficient amount of hormones to enable them to function as they should. It doesn't necessarily mean there is no ovarian function, hence the name insufficient. And there is a charity called the Daisy Network that specifically offers help, support and information for those experiencing POI. Certain types of medical and/or surgical interventions can induce a premature menopause. These can include the removal of the womb during a hysterectomy or the removal of one or both ovaries during an oophorectomy. A hysterectomy, where the ovaries are left intact, may not in itself cause premature menopause, but may cause menopause to happen sooner than would have been the case without the surgery. There are also some cancer treatments that can result in menopausal symptoms. This is often referred to as a medical or a chemical menopause. Once menopause has been reached, a person will be postmenopausal for the rest of their life. Now, for the majority of people, the symptoms associated with menopause will settle down after a couple of years. However, some do find that symptoms can continue for a number of years, occasionally into old age. These tend to be symptoms like hot sweats, insomnia, and joint pains. There are a number of things that can be done to help manage longer-term symptoms, including maintaining healthy lifestyle habits, managing stress, and potentially longer-term use of hormone replacement therapy. Once the estrogen levels drop post-menopause, there is evidence that people are at a higher risk for conditions such as heart disease, osteoporosis, Alzheimer's and dementia, as well as diabetes and hypothyroidism. That said, eating a balanced, healthy diet, maintaining a regular exercise regimen, prioritizing sleep and managing stress can all help to reduce the risk, and the menopause transition can offer a really good opportunity to reevaluate lifestyle habits and form better ones if necessary. It's never too late. Now, hopefully that's given you a high-level overview of what menopause is and when it happens. Welcome to Recognising the Symptoms of Menopause with me, Bev Thorogood. In this short video, I'm going to be sharing some of the most common symptoms related to the menopause, as well as talking about how you can determine if your symptoms are menopause related. Symptoms related to menopause are caused by fluctuating levels of key sex hormones, particularly estrogen, progesterone, and testosterone. We have hormone receptors on pretty much every cell in our body, and as hormone levels drop and fluctuate, then different symptoms can be experienced. There are many symptoms related to the changing hormone levels as we go through the perimenopause, with many medical texts referring to anywhere between 34 right up to well over 100. Now, it's helpful to divide symptom types into three key areas: physical symptoms, cognitive symptoms, and the emotional or psychological symptoms. The more common physical symptoms include hot flushes, night sweats, aching joints, muscle soreness, migraines and headaches, erratic or heavy bleeding, and this can often result in flooding, as well as vaginal dryness and discomfort, hair thinning and dry skin. And there are also some symptoms that are common but not always immediately attributed to menopause, such as tinnitus, irritable bowel syndrome, allergies, dry gums, dry mouth, urinary tract infections, and heart palpitations are also quite common. Now, cognitive symptoms can include things like cloudy thinking, poor concentration, forgetting the words you want to use, feeling overwhelmed, struggling with focus and short-term memory issues. And these cognitive symptoms are often collectively referred to as brain fog. But in severe cases, these symptoms can be mistaken for early onset dementia. Finally, there are the emotional or psychological symptoms, which can include things like anxiety, low mood, mood swings, tearfulness, anger, frustration, and even rage. And emotional symptoms can often lead to behaviour changes that may not be obvious to the person experiencing them, but can be difficult for those around them to understand. It's not always easy to determine if symptoms are purely down to hormonal changes due to perimenopause, or maybe they're due to something else. Many of the symptoms are similar to conditions such as fibromyalgia or thyroid issues, as well as other conditions too. And external factors such as stress or grief can also lead to symptoms that present in a similar way to those experienced during the menopause. It can be hard to know if what you're experiencing is menopause or not. So it's worth keeping a track of your symptoms using a journal or a symptom checker app such as the Balance app, so that you can see if there are any patterns that may relate to your cycle, for example. Now, as a general rule though, if you're over the age of 40 and you're experiencing 3 to 4 or more symptoms that are commonly related to menopause, it's a fairly safe bet to assume that your hormones are changing as a result of ovarian function changes. That is, you're probably perimenopausal. If you are at all concerned, you should speak to your medical practitioner, who should be able to determine if there's anything else causing symptoms. Generally speaking, you shouldn't need a blood test to diagnose perimenopause. There are guidelines produced by NICE, the National Institute for Health and Care Excellence, specifically written to help GPs and medical practitioners to diagnose menopause. And they clearly state that for women 45 years and over, a blood test is not advised. Unfortunately, our hormones are unpredictable and they tend to fluctuate significantly during perimenopause, which means that a single blood test may not tell the whole story and might even be misleading. Now, for those under 45, a blood test may be advised to rule out any other underlying conditions such as low thyroid function, for example. Now, the NICE guidelines suggest that a clinical assessment based on symptom presentation and a conversation with the patient should be sufficient for a GP to determine whether symptoms are menopause related or not. There are some fantastic medical doctors out there who are well versed in modern menopause treatments, and they can support you brilliantly. However, sadly, there are still a large number who were not trained specifically on how to recognise and treat menopause-related symptoms, and it is therefore worth asking when making your appointment, who is the menopause specialist within the practice? And it may be the practice nurse rather than your GP. And it's also worth downloading the NICE guidelines from the internet before you go. Familiarise yourself with them, take them with you to your appointment along with details of your symptoms that you've tracked over a few weeks. I'd also suggest making a note of what you want to discuss so that you don't get there and forget anything, and perhaps think about taking a trusted friend or your partner with you to your appointment. If you do feel like you've not been listened to, or you feel that the advice you've been given doesn't seem right, you can always request to speak to a different doctor for a second opinion. Thanks for watching this video.